year was 2022 was my first full calendar year, and it went really well. And now I have a few reproductive health projects, and I have some nonprofit clients in the health and social service space. But a big area of my focus right now is community health needs assessments for county public health departments. And so I have kind of a little team I put together, and so I will lead the project, and I'll do the qualitative data collection and interview people. And I've got a quantitative person who pulls all the state data sets, and we do benchmarking. And I've got actually a couple folks who speak some different languages, so we can have, multiple language data collection. And that I'm really loving that. And I'm only doing.
Welcome to Public Health Careers. In today's episode, we'll hear more about what nonprofits and other organizations need to make sense of their data, choosing to do an executive master of public health program and work full-time, and the process of transitioning into a full-time as a public health consultant. Also, happy Valentine's Day to you and yours. Hope you all are enjoying your days and sharing love with those people that you do love. As well as be sure to hit that subscribe button if you love this show so you can stay up to date with any great content. Leave a like and a 5-star review and share this with someone or somewhere, as this helps the show get out to more people and grows our audience. And lastly, there's a link to support the platform by buying a coffee below through Coffee or becoming a monthly subscriber through Coffee. So if that's something you're interested in, be sure to check that out. Thank you so much. Enjoy.
Hi, I'm Heidi Berthoud, and I'm a public health consultant, and I work with communities to help make data accessible. And you're listening to Public Health Careers.
Today, we have someone working to improve health, eliminate inequities, dismantle oppressive systems, and make data accessible. She helps health-focused nonprofits make sense of their data. She got her bachelor's in history at Seattle Pacific University, then worked as an EMT and a couple other roles before going to get her Master of Public Health at the University of Washington. She is a principal and founder of Heidi Berthoud Consulting, LLC, where they help health-focused nonprofits, public health departments, and social change organizations demonstrate impact and improve health outcomes through better data collection and storytelling. We have Heidi Berthoud. Welcome to the show.
Thank you so much. It's wonderful to be here. I'm really happy to have this conversation.
Truly is my pleasure. I'm looking forward to hearing more about your insights in your career and the work that you do with your consulting company and how you got involved in there. But before we get to there, how do you identify, and tell us, how are you doing?
Absolutely. I identify with she, her pronouns, and I'm a white female, and I'm based in the Pacific Northwest here in the United States. And I'm doing well. We're starting to have some sort of spring-like weather, maybe early happening here. So it's nice. I know that's not happening everywhere in the country.
Right. Well, I hope that you get to enjoy that weather. And not every day I get to talk to someone in Seattle. So I'm glad to make the acquaintance and glad to have you on the show. So I know you have some expertise in this, as we'll talk more about later. But as we're just getting into this now, what do nonprofits need to do better to make sense of their data?
That's such a good question. I find nonprofits and other clients I work with in health departments often have either too much data or not enough data to help them answer the right questions. And so to help make sense of your data, what I like to bring is a bit of an evaluative approach where you ask the real questions about who do you want to serve and why? What do you want your program to achieve? How would you define success in your program, and what would that look like for you? And then just making sure we have those data to inform those questions. So it's really a process of kind of question, answer, and thinking through that. And sometimes organizations have a lot of data and it's not answering any of those questions. So I really love that kind of sleuthing process of helping people understand how to serve their community better and what questions to ask to do so.
Absolutely. Love that. And on those on these two spectrums there, like the side of people having too much data or when people have not enough data, which side do you think is easier to work with a client? And I know this might be case by case, but like just generally speaking.
Oh my gosh. Oh, I don't know if that's that easy to answer. I think it really depends on how far along they are in their program. If they're just at the beginning and they don't have a lot of data, it's really kind of a nice time to be able to form that process with them. Um, and so probably that is the easier one, to be honest, because sometimes when organizations have collected too much data, it's a lot of kind of unlearning, or maybe too much data in the wrong direction. It's a lot of kind of unlearning and dismantling systems. So I would say those at the very beginning of their process is a lot easier.
Makes sense. Makes sense. It's probably a lot easier to build the ship together than to come already when the ship has been built to then go back and try to fix different things in the ship. Not saying it's impossible, and definitely is needed. So thank you for that work, and we will dive more into that as we get into the conversation. And before we get into more of your collegiate journey, what does public health mean to you?
Hey y'all, you may be looking for ways to show support for public health, health equity, and this platform, the Public Health Millennial. Well, head over to my shop at thephmillennial.com/shop to buy and support if this show has helped you. Also, use the code podcast for 20% off your next order. Link is in the description to the shop. Be sure to tag me on Instagram at thephmillennial. Thank you. I look forward to sharing your pick. Now back to the show.
Oh, I feel like public health is everything all around us. So it's our actual physical health, but it's our mental health, our spiritual health. It's how we get to places and how safe those places are. It's all the things that interact to inform how we live in the world. I think public health touches all of that. Safety is becoming more and more of a public health topic. And so really thinking of it from those overarching perspectives. I know those of us in public health would like to talk about the social determinants of health, all those things that factor in to how healthy you are, both physically, mentally, spiritually, are all components of public health to me. And that's one of the reasons why I loved going into public health, because there's so many avenues. There's so many avenues to explore. And I love that. And it's really overarching so many areas of our lives.
That's absolutely correct. And I love that definition. And I could imagine, like, in your work as well as a consultant, that you get to work with a lot of different organizations, working around a lot of those different issues, and the thought processes there and the data there could be varying to drastic extents. But we'll get to more of that conversation a little bit later on. And I found this fascinating that you got your bachelor's in history at Seattle Pacific University. And while you were there, you also got a certificate in theological studies in Costa Rica. So walk us through like that entire thought process of going into your bachelor's in history and then getting this theological certificate, theological studies certificate, and everything like that.
Yeah, I think history is such a good foundational degree because it really teaches you how to, I think it really teaches you how to think and how to kind of analyze events in the world and how they impacted so many other things that came after them and how things before impacted those events. And so I loved kind of just the intellectual pursuit of it. And I honestly thought I was going to go to law school. So public health was not on my radar at all. And I wanted to be a public defender. And then my theological certificate, I was raised in a very Christian family. And so that just fit right in with my upbringing. But I found a certificate program that was specifically in Spanish in Costa Rica because I really wanted to learn Spanish. And so that was a big part of that background for me. I thought it was really important to learn another language. Growing up in the US, especially being like a white European immigrant, we just, many generations ago, my family immigrated here. So we don't really learn other languages. It's not really a part of that culture that I come from, and I wish it was. And so that was a big impetus for me. Plus, I was starting to do some, I was just having more and more experiences where I was encountering people that were speaking Spanish. And so I really wanted to learn that language. So, and I think the study of theology, I don't want to get into religion in this podcast. I have all kinds of different views on that have changed since my upbringing. But I think just the understanding of theology and different philosophies and really steeping yourself in different religious ideologies, there's huge importance there too. To me, they kind of go hand in hand with history in some way. It's really observing all of the ways that different cultures think and operate their lives. And I think that's really important. And bringing that to public health is really important too, because so many of the cultures, communities, immigrant communities, refugee communities that you may end up interacting with in public health all bring their different belief systems. And so it's really important to just, I think, be able to recognize those and honor those and kind of understand how to be flexible in your thinking.
I love that perspective, and I think that is important. And while history mightn't seem like the most relevant topic when thinking about someone who wants to go into public health afterwards, I kind of think of it like as a foundational, like in the sense like sociology, anthropology is very similar to those, in the sense that you can get a grasp of population, of society, of those like larger level, societal level problems, issues, things that need to be fixed. And it definitely does allow you to bring a lot of different perspectives into public health and understanding into public health that someone with just a public health degree mightn't understand. And I also love the fact that you're like, okay, I want to learn more about theological studies and I want to learn Spanish. Let's go and do it in Spanish. And like that kind of forces yourself to be able to learn. And I could imagine that was a lot more fruitful than maybe just trying to take a class in Spanish while you were in university, but like really immersing yourself. And like to the point of what I was just saying, also immersing yourself in a different culture and understanding like what that means for you as a person, as well as like in your public health career. Granted, I'm not too sure. You said you wanted to go to law school, but we'll figure out how the public health came into it in a little bit. So did you want to share any other undergrad takeaways before you talk about your experiences after your undergrad in the community clinic as an EMT and as a clinical research coordinator?
Yeah. One of my undergrad experiences, I also did a study abroad in China, and we traveled all over the country. And when I think back, I think that in my time living in Costa Rica, but specifically in China, I think I started to really plant the seeds of public health because I saw, particularly in some of the rural areas of China then, this was a long time ago, but I started to see what we would now understand as health disparities or health systemic inequalities and social determinants of health. And so, all of those travel experiences I had and really immersing myself in other cultures started to highlight that for me. And we have all of that here in the United States too. So I definitely don't want to make it seem like it's just other places. It's definitely here too. But I think I started to just really see some of that, and it started to form that foundation. That was those were my undergrad experiences. I really tried to absorb other cultures and travel as much as I could.
Which is something like I advocate that people always try to do. If it's like feasible, it's always a good option to do that, because the learning and the experience and the exposure that you get to other people's life and how they live is just, it's fundamental. And I think it could be very helpful. It is very helpful to a lot of public health people in just understanding like everything that you're saying. Like, yes, I understand that there are disparities abroad, but I also understand that there are disparities here. And I understand that life and health and all of those things are viewed from a different lens. I completely advocate for that. Okay, now walk us through the process of your few jobs after your bachelor's degree. And I guess before you get to like those few jobs, what was your thought process coming out of the bachelor's degree with your history and your theological study certificate? What were you thinking after that?
I honestly wasn't sure. Law school was definitely on the table, but I didn't want to go straight into another school program. I really wanted to have some kind of work and life experience. And so I got various different jobs. I'm trying to actually think I worked at, I did eventually end up getting an EMT certificate and started working as an EMT because at some point I thought I was going to go into clinical care and like direct patient care. So I wanted to get that experience through EMT, but I also worked at Bastyr University, which is actually a naturopathic university here in Seattle. And I helped set up clinics for students to go and work with patients. So that was a really fun job because I was working all over the city, like, senior centers and low-income clinics and places like that, and just making these connections all over the city. So that was really kind of starting to build my thinking around public health. And then I just also had some personal things happen that just shifted my thinking. I had a really close friend die by suicide, and it completely shifted my thinking on how we interact with health and mental health, and honestly kind of rocked me for a little while. And I think that I really abandoned the law school thinking there and started going towards public health. And so I worked in our nonprofit like county hospital here in King County that serves a really diverse community, and just started building those experiences. But really, when I was an EMT and I was going to people's homes, I really started to see also those social determinants really impacting who was getting care, who was able to access care. My Spanish came in handy quite a few times. And just really seeing where there were some real gaps for sure in how care was available to folks. And that just really started to solidify for me even more that I didn't really want to do direct clinical care, although I think that's extremely important. It really helped me understand. I just wanted to go straight into that kind of population level health, public health field. And so that's where I went and started my master's degree in public health. And I actually did it at that time. I was several years out of undergrad, and I needed to work full time and go to school. So that was something that was really nice. I know some of your listeners are kind of getting into public health, but it was and so this could be helpful, but it was a really nice, it's called an executive program. So I was able to work full time and then do the public health program. It was a lot. I won't deny, but it's those options are available for people if they don't feel like they can just, quit their job and go to school, because that wasn't something I could do. So that was great. And I met so many wonderful people through that experience. And then I also completed a global health certificate concurrently. And that really launched me into kind of, to my public health career for sure.
Yeah, well, I appreciate you walking us through that, and definitely very helpful. So, and condolences on the loss of your friend. That's always never good to hear. Okay, but like moving forward, and I'm glad. I'm always glad. Like I'm not glad about the situation, but I'm glad that like people take those kind of situations and then push on to try to do work to fill those spaces, and to not actually say, okay, this is just an issue, let me just think about it as an issue, but actually try to do the work to fill in those gaps and to create resources and whatnot. So you said during your time as an EMT, you would go into people's houses and you really see like how access to care, the disparity or the disproportional lack of access to care certain people would get. Was this when you learned about the terminology for public health, or when did like public health come up? Because you said like you want to do clinical, this happened to your friend, you realize, okay, I don't really want to do that, I want to push more into like the health side of things. So when did the word public health come into like your vocabulary?
That's such a good question. I think probably around the time, well, before I worked as an EMT, I forgot to say I started working in research. So I was in a research clinic. And I think the terminology started coming up then for me. And I was looking at different graduate degree programs, and Seattle and the University of Washington are really known for public health. There's a big global health network here. So probably around that time, but that's a really good question. I think it just sort of seeped in to my consciousness at some point in that process. And being involved, like working at a hospital and then working at different kind of clinical settings. And I think that concept of understanding what was happening at a population level, because I was also interested in kind of policy and how that happened. And so I think over a couple of years, it just sort of, seeped into my consciousness, and I started meeting new people who would talk about it. I think some of the folks I worked with would have like a dual MD, MPH, or PhD, MPH. And I was always curious about this master's in public health. So I don't remember like one distinct thing that sort of made that be clear to me, but all of that started to just kind of become more and more clear to me that that's what I wanted to do.
Yeah, and I think like maybe it's just the proximity to being in a health related field and working in a health related field and with people. Because that's what I hear from many people who come on the show. It's like, yeah, I went on this trip and I saw people with MPHs, or like I worked with this doctor and they had an MPH, and then they learn about public health through that. So absolutely makes a lot of sense, especially when you're dealing with people and you're seeing that there are larger social impacts here that need to be fixed in order for these people to get the best type of, to get their needs served in the best way possible, and to get the resources that they need. So like throughout that process, being an EMT, working in research, what was it, the thought process of like deciding to go and get a Master of Public Health? And you got your Master of Public Health at the University of Washington School of Public Health.
I felt like, as I was looking at different roles and career opportunities, I felt like, honestly, what I would do is I would read job descriptions that looked really interesting to me, and they almost all required a master's degree in public health. And so that was really one of the things that I thought, that seems like something very interesting to me. It's really fitting all the needs that I've been kind of slowly identifying over, the few years after undergrad. But that was something that kept coming up. Like the coolest sounding jobs all wanted an MPH. And so that really kind of pushed me in that direction too. And then I loved like I spoke about earlier, just the breadth of what you can do in public health. There are so many options. And I think that's always been kind of a part of my personality. I love the options. I didn't want to feel too tied down or, stuck in a career. And so that seemed so cool because I was like, I could go in behavioral health. I could stay in research. I could do, direct outreach, like direct public health work in a community. I could work abroad. That was super appealing to me. So I think those two things were the really big kind of aspects that pulled me in that direction. And then I did want to stay in Seattle. I really love it. I love the Northwest, and I'm a big outdoors person. And so the fact that the program here was really good. I mean, I did look at other programs, but it just kind of seemed like a really nice coincidence and a good fit.
Yeah, that absolutely makes a lot of sense, and I'm glad that you were able to get those experiences. And that's one thing about public health. Like I feel like it's a tale of two coins, or two sides of the coin. You have the one side where like, I don't know what I want to do, but I know that I can do so many things in public health. I love that, and some people are like, oh yeah, I hate that because I really want to know what is my job, what is the thing afterwards, and it's kind of hard to pinpoint that for a lot of people. And I'll ask you a question around like figuring that out for yourself a little bit later on. But before I get into that, like talk more about the graduate certificate in global health that you got, and maybe any other experiences that you had during your Master's of Public Health program.
Yeah, I had a real, how do I even vocalize this? So I had a real interest in global health, or what we think of, in the field as global health. But I also had some just kind of conceptual issues with some of the ways that global health was happening. Like it did sort of feel like colonization 2.0 in a lot of ways. And so I wanted to learn kind of the themes, because a lot of the themes of global health are like how to implement public health in a really low resource setting, like how to collect data with no electricity. Like some of these things are just like really interesting practical ways to like run and understand and evaluate public health programs. But I was always struggling with some of those larger kind of issues around global health. And so that's partly why I wanted the certificate. I knew there was really good professors here at the University of Washington, and I had contemplated trying to work abroad as well. So I wanted to have that opportunity. And then I did do my thesis work in the Dominican Republic, which was an amazing experience. And I did household surveys in a small bate, which I don't know if you're familiar with the DR, but bates are little communities that were built, like they're like little company towns for the sugarcane factories. And sugarcane factories were super extractive to both the people and the land. And so when they shut down a lot of these little bates, like they didn't have running water, they didn't have they were like public health disasters, quite frankly. And so, but folks had to live there. And so I was going around and just doing surveys of how people access their water and how they like just kind of some basic understanding of the hygiene around water access and water quality. And I was able to connect with some local folks who I kind of brought on board as my like local researchers, which was really fun. I love doing that. But while we were there, they had their first cholera outbreak because this was a couple years after the Haiti earthquake. And it really brought a lot of tensions between the Dominicans and the Haitian immigrants. And so I had to pivot my research a little bit in the field because I didn't want to exacerbate these tensions already there. But I also did see, there's a lot of really important work happening in the global health space. And there's also a lot of like folks that just kind of helicopter in and do something for the photo op and then leave. And it makes me livid. Like I just can't stand it. So, but it was a great, it was a really good experience. And actually those folks that I worked with they've worked with a local nonprofit and they've been able to move a lot of work forward to get better water access. And actually on Facebook just last year, it's been like over a decade since I was there, someone tagged me and they were like, that I had worked with and I've kept in touch with, and I'm not even on Facebook anymore. So I'm glad I checked, but they were like, look, we actually implemented this water plan and they had like repiped some things and they had clean water and they took some pictures and it just made me so happy. I mean, it was like, maybe I was a tiny, tiny, tiny part of that, but that's like public health happening in a community. So, so that was my thinking in the global health certificate is to like gain some of those skills to do some of that work. But then in the end, I opted not to work abroad.
Yeah. Well, I appreciate you sharing that, and that's awesome that you were able to go to the DR and support that work. Also, shout out to you for like being conscious enough to say, okay, things are going on here, and I need to pivot the research that I'm doing because this is not supportive of the community, which is awesome. As well as I've heard that tale many a times from people that study in global health, and then they feel like it's very extractive, very helicopter like, or just neglecting the issues that are already happening in other global countries, such as the US, like it's not like we have all the issues here solved as we know very clearly, but that's for, but I think that's a perspective that a lot of people do realize when they do start studying global health. And it is always interesting I feel like to think about it and to think about how we do practice global health and just supporting developing nations as they develop. So I appreciate you sharing that. And then did you want to share anything else about your MPH program?
Oh, I met such great people that I'm still friends with, and we still work together and collaborate. And I think anyone who's thinking about a graduate degree program like that, just go in and try to build relationships. I mean, definitely the learning is important, but the relationships and with professors, those might be things that carry you for a long time in your career. So I think, and I'm so glad I got it. Like I think every job I've had since then, I know every job I've had since then, I wouldn't have been able to get if I didn't have that degree. And I know there's some new thinking happening in the space around degrees and requiring degrees for things. And but for me, it was really important and crucial. And I think it gave me the learning and perspective that I needed and wanted in this public health space.
Yeah, love to see it. And one other question is around the executive program. You said that you did an executive program, you worked full time. How was that, like balancing that work, both being full time and doing an MPH program?
Yeah, it was challenging at times. So it was like 2 full years. So I would have like these intensives in the summer. So I think the first summer it was like a 1 month intensive. So I had to take a leave from my job, or I took vacation. I can't remember how I did it, but it was a lot. It was a lot of, and this was like before we all knew how to like live on Zoom like we all do now. So the technology wasn't as good for some of the distant, like some of the kind of online hybrid things, but I overall am just really glad I was able to do both, and pay. The nice thing was my full-time job was at the University of Washington too, so I was able to get some tuition discount, which really helped. Another great tip for people if they want to pay for school, it was great. So that, and my supervisor was really supportive, but it was a lot of juggling for sure. And I think if you had a lot of other, like if I had little kids, or if you had a lot of other things going on and you were trying to work full time and do a program, it'd be tough, but doable. Lots of people do it, and I think it's a great option for people to not have to incur a lot of debt, or whatever that looks like for them.
Yeah, appreciate you sharing that as well. So after you graduated from your MPH and with the Global Health Graduate Certificate, your first job out of your MPH was a research associate and project manager at Kaiser Permanente Washington Health Research Institute. So tell me, how do you come across that, and then what do you do in that position?
Yeah, and actually when I started there, it was called Group Health Cooperative. So, and then it was acquired by Kaiser while I lived there, or while I worked there. But that was, so they did a lot of all kinds of different research, but there was a lot of kind of community focused population health research happening there. So that was really interesting to me. And I had worked for 5 years at the Research Ethics Board at the University of Washington, and I worked in research prior. So it was a nice transition because I was moving more into kind of the applied research health, public health space, but it utilized a lot of the skills I already had. So that was great, and I learned a lot. I met a bunch of great people there, and I learned a lot more about kind of different types of health approaches and implementations, and working in a healthcare system like group health and then Kaiser too, you understand a lot more about all those factors of how a healthcare system supports the community and how people interact with health and healthcare. So, and Kaiser is very much of tries to take a holistic approach, which fits my philosophy of public health as well. So they really try to think about all the different ways that you're impacted by health, kind of like my definition of public health earlier. So that was a nice fit and a good transition out of my master's degree at that point.
Yeah, that sounds like a great fit. And I can imagine the amount of organizations like Kaiser probably bought up since then. But yeah, that I definitely like Kaiser Permanente, just generally speaking, the news, the information that they put out, as well as the holisticness, like as you're saying, of them really like thinking about all the social determinants of health and seeing as a health system how they can support the people the populations that they work with, or the clients, patients, however you want to define it. But yeah, and I can imagine that's also probably a pretty dope like first job out of your MPH program, to work for that kind of organization.
Totally.
Right. And then after that, you became a state impact officer at Upstream USA. So how do you come across that? And then what do you do in that position?
Yeah, so one of my kind of side passions and interests for a while has been reproductive health and reproductive justice. I've worked on endometriosis advocacy and research on the side for years, since I actually had my own endometriosis diagnosis and a bunch of surgeries, and had so much trouble accessing good care. And realizing there's like no research on this disease, but it affects at least 1 in 10 people who identify as women. Not even people who identify as women, people who have a uterus. 1 in 10 of them probably have endometriosis. And I just, I couldn't believe that. I should have known, but I couldn't believe there wasn't more research out there, and it's definitely one of those diseases that disproportionately impacts women of color because of their access to care. And so Upstream USA, so I've been working in kind of this reproductive health space and was really interested in working in it more. And Upstream was a reproductive health nonprofit startup, although they were a little bit less of a startup at the time, but and they were branching out into a bunch of states around the US. And their goal was to increase access to contraception and family planning in communities, particularly communities where that wasn't very accessible. So we had a training program for physicians where we trained them how to place an IUD or an implant. We did a lot of education with providers and staff around coercion and like anti-coercion practices in reproductive health. So it was great. And I ended up, I started, my title was State Impact Officer, but then I became the Director of Monitoring, Evaluation, and Learning for the State of Washington program. And that was great. Like, so I was setting up monitoring and evaluation systems. We were trying to understand, this whole project was just launching. So it was really fun to be at the beginning and launch this initiative into the state and really, make some good connections and some good progress on this issue. And just, you would think, it's funny, I remember going to some networking event and I told this woman what I did and she was like, I thought contraception was available everywhere. Like, I didn't even know this was a problem. And it's a good point. Like, I think a lot of people don't realize there's still communities where it's hard to access, or there's not that many providers that actually know how to place an IUD. So, the options and choices for people are still not, they're still like disparate, across the country. So, so that was really great. And it really got me even more into kind of a public health focus that I was really interested in.
Okay. Yeah. And that's awesome that you're able to like move from the state impact officer, work more into your passions in reproductive justice, reproductive health, as well as get promoted into like this statewide director for monitoring, evaluation, and leading. And like your next position, or I'm guessing maybe you did this while you did that, was an independent consultant for monitoring and evaluation, which you did between 2014 and 2021. But the question that I wanted to ask, like prior to this, is like where, because the evaluation side of your skill set comes up when we talk about your consulting business, and then when we talk about these monitoring, evaluation, and leading positions or consulting. When did you learn like that data skill set or that evaluation skill set and really put it into action to like be confident around that?
Yeah, so when I was at the Research Institute, I worked on some projects where they were big evaluations. So our team would subcontract to a larger national team, and we worked on some big evaluations around the Centers for Medicare and Medicaid. And then there was a big national evaluation on heart health. So I was usually on a team as a part of a larger team. And so I kind of just got exposed to like all of the evaluation things. And then there was a couple other kind of state ones too. So it was in that time there that I worked on teams that, and I did kind of bits and pieces. But the thing that I learned there that I really loved was qualitative data collection. So that's interviews, focus groups, observation, like all that kind of interpersonal, personal, community level data collection. I loved it. So that's where I worked on several different projects where I was doing stakeholder interviews and, collecting that data and getting the transcripts and then analyzing them. And that, I just loved that approach and how rich it was. You just get a really rich data set from being able to talk to people. So I learned all that at the Research Institute. And, some of it I had learned kind of conceptually in grad school and for sure conceptually in my previous research jobs, but like I really got to use it when I was at the Research Institute. And then you mentioned my independent consulting. On the side, I would do some consulting work. And so I had a project where a colleague and I was invited to, we were evaluating a healing to wellness drug court with an Indigenous population. And so that's where, and actually another colleague invited me to do some other survey development work with Indigenous populations. So that was really special because I feel like when you're invited in by Indigenous people to work in their community, it's so special. Like as a white person, I'm so conscious of trying to be as humble as I can, and like it really opened my eyes to like concepts of data sovereignty and, giving the data back to the community, because there's so many examples of research data just being taken and, exploited. So kind of tangentially, I was doing some other projects that were also giving me those skills, and I was interacting with the community. And there was another one I was gonna. Anyway, and then some survey development and things like that. So yeah, it was kind of it was a definitely on the job learning experience for sure to gather those skills, which was great. I mean, for me that was that made it feel more applicable, and I learned really well that way. So. But it definitely like instilled this passion for qualitative data collection in me.
That's some great insights there, both sharing on the side of like you well, first of all, you learn how to love, or like you learn to your love for qualitative data and what that means and how to collect it and how to use it. And then on the other side of like being a part of a bigger team that's doing a lot of large evaluation projects and being able to tap into like different parts of that process and just understand all the different pieces, which I think is always helpful in like making us think about the big picture of things, and just creates that environment to learn, and as well as having the people there to probably ask a lot of the questions and bounce ideas off of, which I think is a great way to solidify that knowledge. And then talking about before you got into like full blown consulting, you said you're doing this independent consulting after talking about what was that thought process of like doing this consulting? How do you say, okay, was it just you woke up one day and I was like, okay, I'm going to do some consulting on the side?
No, but the idea was kind of, I think it goes back to what I was saying about how I loved that public health has so many avenues. So the projects I was working on at the Research Institute were interesting, but there was like other projects I wanted to do, but they weren't available there to work on. And so it was, I think, more of a just, I want to do all of the things. And so when someone came to me with, to work with these Indigenous communities, I had been thinking about doing work like that for a while. And I think a lot of the concepts in global health are very present in some Indigenous communities too, like the oppression that they have experienced and the colonization that has like impacted their health long term. It's right here, and they're experiencing that. And so that was interesting to me to be able to do that, because that was not available, at Kaiser. That was not a population they were like readily seeking to work with, at least when I was there. So for me, it was, it just felt like such a great opportunity to support a colleague and work with other communities and kind of get back into community work. I think that was another thing, is the research side. I was like, it's like a 10,000 foot view, right? And I really wanted to like do more kind of on the ground type work. And so that was another reason why the consulting was really a great balance to what I was doing like in my day job.
Yo, are you looking for an online community to connect with like-minded health-focused people? Join my free community health and wellness Discord server at thephmillennial.com/join. You'll find growth-focused people talking about important community and personal health topics, networking opportunities, online yoga, book clubs, and more. Be sure to introduce yourself when you join. Link is in the description. Now really, back to the show. Love that. And I think like a lot of people probably feel that similar way, where they get into do this work, but it's disconnected from the community. So this is an avenue that you can think about to make you like get more connected to the community and that type of work that maybe excites you a little bit more, whether that's consulting or subcontracting through a consultant or whatever the case might be. But just knowing that like it's an option that you can do in public health, which is important.
Yeah.
And I guess just because you brought it up, being a white person working with Indigenous populations, what was that thought process for you? Like going in, like, or I should ask, what advice do you have for another white person that's going in to work with Indigenous populations? What advice would you give to them?
Have an Indigenous partner that you're working with. I didn't seek I didn't seek these out, but I had a good friend from grad school who was Indigenous. And so we were already friends. And then she invited me to work with her. I think just seek to understand, seek to know. So try to just build, real connections and relationships with people. I think that's the key. I never have advertised myself to Indigenous organizations because that just doesn't feel right. But work has come to me through word of mouth. That's me. That's my philosophy. But I think it's an important one. And I think for the Indigenous communities that I've worked with, relationship is everything. And it's huge, and it's a huge part of their culture too. So, and because as a white person, like, they have no reason to trust you because history has not like demonstrated that you would have their best interest, So I think just building that relationship, and like some of the relationships I have been, it's been many, many years. So for me, I think that's really important.
Love that. Kind of like just being intentional and taking things slow, I think, is one big part, as well as like knowing that you yourself are not specifically targeting Indigenous people or Indigenous organizations in your work, but if they are wanting to work with you, you're happy to do that. And as you said, like a lot of relationship building and network building and just building trust with people, I think is very important. So I appreciate you sharing that. And then getting back to like the big question that kind of came up earlier is like, we spoke about public health really appealing to do a lot of different things. So what advice would you give to someone who is thinking about their career in public health? Maybe they're just starting off and they like the appeal that you get to do a lot of things, but they also want to find a career afterwards. What advice do you give to them?
I think you can still find a career and do lots of things. So like, I think working in a public health department, there's often a lot of different avenues. You've got administrative, but then you've also got kind of the vaccine rollout. You've got community health initiatives. You've got a lot of different areas you can work in. And I think, I think in public health departments, or even like maybe academic organizations, there can be room to move around, or move up for sure. So I think, but I think figuring out, what do you really like? Do you like crunching numbers and like sitting at your computer and no one bothering you? Which we need folks like that. So if you like that, then maybe epidemiology is your jam, and you're going to be able to like plug right into a department and like just look at data sets all day and crunch numbers. Or do you want to be out? Do you want to be like kind of like a community health worker? Do you want to be out like, working in the community, talking to people about health? So I would really think about what you love and what you enjoy doing and what brings you life and joy. And there's probably something in public health for you, whatever your interest is. So and sometimes those change over time, but I think really being true about what you really like to do.
Yeah, love that. And I think like to your point of going into like a public health department or an organization that has a lot of different ways that you can pull on those different passions and those different appeals, and maybe like from there you figure out which one of these things I enjoy the most, and then leaning more into that. And like as you said, you can always change, and I think like changing is fine, and there is power in that. Okay, so moving on to your current company. So you're the principal and founder of Heidi Berthoud Consulting LLC, where you'll help health-focused nonprofits, public health departments, and social change organizations demonstrate impact and improve health outcomes through better data collection and storytelling. What was your thought process in founding this?
Well, I was working at Upstream USA, and the pandemic hit, and it really threw the organization for a loop, and a lot of leadership left, and I realized I was going to need to leave too. And so I left my job unexpectedly and did not have another one, which I've never done before. I've had a job since I was 15. But I sort of thought maybe this is the time. Like I've always, since I'd started independent consulting on the side, I'd kind of thought it'd be kind of cool to try this full time. I mean, it's kind of terrifying, but it'd be cool to try it and just see how that goes, and if I can do it, and if I can, pay my bills and all those things. So I started talking to a couple of people I knew who were consultants. I had one friend who said, I've got a small project I can hire you for. I think you should do it. It was really just a couple. I just had one or two people that said, oh yeah, I think this is doable. Here's a tiny thing to get you started. And I just went for it. And I didn't have a lot lined up. A lot of people start and they have like a whole client list already. And I really didn't have that. But I was able to, I love relationship building. So I made a point of I think I emailed everyone I know and just said, I'm starting a business and here's what I'm doing. And do you know anyone, or can I talk to you? And I just kind of got bold about reaching out. And I set up so many Zoom meetings because this was 2021. So it was still pandemic. It was like mid to end of 2021. And then I found a business coaching group that was great. And there were some real serendipitous relationships that connected me with a few things. Previous relationships I had made, people made connections for me. And I just started building it slowly. I did some grant writing for a woman who runs her own grant writing business. And there's always a need for grant writers. It's not my favorite thing, but I really liked working with her. And that connected me with some other projects, which then has built. And so, last year 2022 was my first full calendar year, and it went really well. And now I have a few reproductive health projects, and I have some nonprofit clients in the health and social service space. But a big area of my focus right now is community health needs assessments for county public health departments. And so I have kind of a little team I put together, and so I will lead the project, and I'll do the qualitative data collection and interview people. And I've got a quantitative person who pulls all the state data sets, and we do benchmarking. And I've got actually a couple folks who speak some different languages, so we can have, multiple language data collection. And that I'm really loving that. And I'm only doing Washington State right now, but I think I'd like to branch out into other Northwest states. But these public health departments that come to me, they really want to hear from their community. They want to hear what's happening. They want that community voice. They want to know what people are thinking. And that is really cool. Like, to me, that is those public health departments, I think I think they're going to really reap the benefits of that, of really reaching out to their community and trying to understand what's happening in the community. Because sometimes those needs assessment reports are just quantitative. They're just data. But it doesn't have that richness that I really love. So that has been really exciting. I've got more of those lined up for this year, and I've been speaking at conferences about them. And I just, one of my goals, I didn't actually talk about this earlier, but one of the reasons I started working at Upstream is because I had done national work and I'd done a little bit of international work, and I was really wanting to get hyper local, what's happening right in my state and right in my community. And so that was one of my visions for my business, is how do I work right here? Because there's a lot going on. We have 29 federally recognized tribes, and we have a big refugee communities and immigrant communities, and there's a lot. We have a big migrant worker population. And so that has been really a nice surprise, that I did not set out to do these needs assessments. I really like them, but I just had the opportunity to do one last year, and it kind of launched this new side of my business, which I'm really enjoying. So that's the bulk of my work. But I also help some smaller nonprofits make sense of their data and do program evaluations and things like that. So it's a nice mix.
Yeah, and some great points there. I think when you mentioned you started off and you were able to subcontract with someone else, which I think is a great thing that anyone who's interested in getting into consulting should try to do, get their feet wet, build those relationships, things like that, as well as reaching out to everyone in your contact list and letting them know that you're starting this business. I think that is something that a lot of us shy away from, and for egotistical reasons, of course, which kind of you're creating this new thing. The only way for people to know about it is if you tell people. So I love that you were like proactive in saying, okay, this is my network. These are the people. Let me let them know what I'm doing. Yeah, and then I really love how you like through this work you're able to find your niche and see that you can support organizations, I should say, in collecting that data, and specific to public health departments who want to hear more from community outside of hiring Heidi Berthoud Consulting to support their work. What advice would you give to those kind of organizations?
Organizations that are trying to do that work.
Yeah.
That's a great one. I think really think about your kind of why and what you're wanting to do going forward. So one of the big things that's happening right now in all public health departments, but definitely any organization working in health and public health, is we're kind of coming out of this pandemic phase, and there was a lot of things that got stalled or stopped. There was a lot of disinvestment in community because everyone was responding to a pandemic. There was a lot of tension with communities in public health around mandates. And so I think really like wanting to understand what your why and like what's next question is as an organization, like what's next, so what, then what are we going to do? And then really being willing to be patient and listen, because the qualitative data and getting information from your community takes some time, and building community takes time, and kind of rebuilding some of those connections between public health and communities. It's going to take a little bit of time. This has been, and we're not out of it yet. We're still technically in a pandemic, but it's been hard for a lot of people for a lot of reasons, and there's been a lot of loss. And so I think having some grace, listening, and then really asking like why, what do we want to do next and why is really important.
Okay, great advice there. And then on the side of you saying that last year was your first full year as a business, and I heard you say that you have different people that are doing different parts of the work around maybe community health needs assessment, someone doing some focus groups in Spanish or whatever the case might be. What was that process like for building out your team? And then like what advice do you give to other consultants that are working to build out a team to support community-based work?
Relationships. So the folks I have on my team are all subcontracting to my business. I'm not in a position or interested, quite frankly, in hiring full-time staff right now, because I have the needs I have are kind of, it's more like I need to plug someone, a skill set in here and skill set in there. And I've been building a network of consultants who that's all they want to do as well. They just want to plug into projects here and there. And so I've just been building those relationships over time. And, I worked with some folks on a needs assessment last year, and then we connected really well. And then that's how they're going to work with me going forward. Then they connect me with their colleagues. So I'm always, and then I return that. So I connect other consultants with people. I'm always trying to reciprocate that, because we're all building that for each other. And I have a really good network of other consultants and who are running their own businesses, small businesses. And we help just brainstorm with each other, or like, hey, I have this contracting question. Have you ever had this issue? It's really nice to have that network of kind of business support too, because when you're running your own business, and it is, if it's just a small team of you, or it's just one, or however that is, it's nice to have a couple folks that are like your work buddies that you can say, hey, like, this is weird. Have you ever encountered this? Or, hey, do you have any onboarding documents for subcontractors? I literally just asked this of my network the other day. Like, what are you guys thinking about for, this and that? Or how do you set up your taxes? Or, all the things that come up, because I didn't know anything about running a business when I started running one. So I've learned a lot. But the building of the team, one thing though I may end up doing this year is hiring a part-time assistant to just help with some of the administrative stuff as I'm growing so quickly. But stay tuned. I'm not sure how that's going to look, but I have some ideas, and I have a lot of other consultants that are helping me think about that. But right now, I'm really interested in building a team of subcontractors with expertise, like really specific expertise that I can bring to teams. Another one, I'm going to interview some visual designers next year, because one of the things next week, one of the things I really like is making the reporting super visually appealing and accessible. I want anyone to be able to open this report or read it online or whatever and immediately get it and not feel like you have to have a PhD in epidemiology to read my report. I love the accessibility piece. So I want, I could do visual design, but it's not my highest skill set. I definitely want to find someone who can do that really well and make a high quality product. So some of this is I'm learning as I go, but also just really knowing what are my skills, what do I do really well, and what is someone else going to do much more efficiently than me. And if so, I just need to hire them to do what they're good at.
Yeah, that self-awareness as a business owner is very, very important. And like offloading work that, as you said, like who's the expert in this specific thing? Let me get them to do this part while I can focus on like the bigger project or whatever the case might be. And I love the point of just building relationships with other contractors out there and plugging them into the work, and as well as like you plugging into whatever the work they might be doing, and just like creating that relationship pool of people that are able to do subcontracting work, which I think is awesome as well. And then on the administrative side, or like on the business side of things that isn't like client facing, was much of that learning just leaning on those relationships from the network and maybe like online resources, or what was that process like learning?
Yeah, it was a lot of talking to other business owners. I mean, there's a couple podcasts, like business specific podcasts, that I started listening to that was helpful. I had a business coach that I found early on, and she did kind of group coaching, so it was affordable for me. And that was really helpful because she would just do kind of like open office hours. So we'd all just get on a call together and people would just kind of popcorn around with their problems. And it maybe wasn't a problem that I had, but I probably was going to have it if I hadn't had it yet. And so it was just helpful to hear everyone's feedback. So yes, definitely reaching out, connecting with other business owners. There's some online resources too. Like every state has their own like small business administration. And so I found things that way. Like I did tons of free webinars. Like I would jump on any free webinar at the beginning when I wasn't very busy, just to like learn, about taxes and an LLC versus an S Corp and all these terminologies that I didn't know. And then asking around, what type of business insurance do you have? What do you recommend? And all of those types of questions. Yeah, I definitely really use my network for that, which was great.
Okay, awesome. And I'm gonna throw out a little soft pitch for anyone that might be listening here. So let's say that someone was to reach out to you to say, okay, I'm expert in this type of work, or I would like to develop some more expertise, but I have experience in this work. Would you be able to subcontract with me? What are those kinds of skill sets that you are looking for in people that subcontract with you, just generally?
That's great. Quantitative data collection and analysis, specifically like large state public health data sets. Qualitative data collection and analysis, so interviewing, focus groups, and the analysis that goes with that. And I'm particularly interested in folks who can do that fluently. And I mean, ideally a native speaker. So, I can speak some Spanish, but I would much rather bring on my colleague who is a fluent native speaker. I'm actually really trying to find some resources in Somali right now. So I have a Somali client and I'd love to actually get some translation resources in Somali, Arabic, and Afghani. So that's something I'm looking for. And then, like I said, I'm going to talk to some visual designers next week. But I think kind of those bigger data collection analysis skill sets are really big right now.
thank you. And anyone that is looking for subcontracting type of work, just try to build out those skill sets so that you are an asset and can be subcontracted for work going forward. So thank you for sharing that, Heidi. And then to your, I know that this is like a relatively new business that you have here. So what are some of or one of the biggest successes and biggest challenges that you've had?
I mean, one of my biggest successes so far is it looks like I'm doubling my work from last year already this year, which is, I think it's actually more than doubling, which
That's
is
awesome.
Really wonderful. It's really exciting. And that I'm really excited about that. That feels really, it feels like this could definitely be sustainable for me, which is great. One of the biggest challenges is so one of the things so my work is doubling or more, but one of the things I really set in place when I started and then that I really want to hold to is not overworking, not burning out. I don't know if you follow, there's this amazing Black woman out of Atlanta who runs the NAP ministry, and she talks all about, she's specifically talking to a Black audience, but she talks all about rest and, rejuvenation and the importance of rest. And so I think it's balancing that, how to be busy and run my own business, but also like protect my evenings and weekends and maybe try to work a 4-day work week. That's something I've been really trying to implement. Like, how do I, balance that while still delivering good products for my clients and doing good community work? And so I think that's a real challenge because I think a lot of things around us, just especially in this kind of American culture, is like just focused on more and grow and get bigger. And I want to grow my business, but I'm also wanting to grow it wisely and in a way that doesn't max me out and then I can't do it anymore, because that's no fun. So I think that's kind of a constant challenge. I like to do lots of different things. I like to be involved. I have a big kind of life outside of my work, and so just wanting to maintain all of that, and be mindful of it. So it's learning to say no. It's setting boundaries. It's really being mindful about the work I'm taking on. There are some clients who come to me and I said I can't start that till July, and so being able to say that, and that's okay with them, which is great. So I think that's a challenge for me, and I'll just continue to figure out how to make it work.
Yeah. Challenges of scaling and growing a successful business. All good problems to have. And I hope that you're able to continue to grow and grow out of those growing pains and continue to build the organization.
Thank you. Thanks. Me too.
You're most welcome. You're most welcome. And before we get to the Furious Five, I wanted to ask, where would you, or is there anything else that you'd like to share about Heidi Berthoud Consulting or anything around that, or consulting in general?
I think if anyone's been thinking about it, and you've already mentioned this, but try subcontracting and do some consulting on the side and see what you think about it. The idea of running my own business was terrifying to me even 3 years ago. It was not even on my radar, and then something will change and you're just kind of in a position where you're like, this is it, I'm going to go for it, and it's working. But I don't think you need to feel like you're some business savvy person or that you have always wanted to be an entrepreneur to start your own consulting business. There's a real need. I was going to say the other need, which I don't have yet in my business, but the other need I see around is definitely program evaluators, facilitators, strategic planning, action planning. There's a lot of space for that if folks want to, start up their own business. So I would say don't be too afraid of the things that sound scary about it, because there are people out here who are willing to help you and to network with you. And I've been just amazed at the community I've found in building my own business, which I've really loved.
Love that, and thank you for sharing those other subsets or skill sets that people could work on building out that will make them valuable in this type of work. Okay, now get back to my question. Where would you like to see yourself in the future?
Continuing to be able to travel and experience other cultures, continuing to be able to be mindful and aware and open in my thinking and who I am. And I would love to see my business just go and go and go. I can't see myself doing anything else right now. I just love what I'm able to build right now. So I see myself doing this for a long time, and hopefully working with more communities and building more connections.
Awesome. Love that. And we look forward to seeing the growth of your business and the growth of yourself. And I'll be sure to follow along because, I will for sure. And then moving on to the last section of the show, the Furious Five questions I ask all guests. So number one, what advice would you give to a student trying to pursue a career in public health?
I mean, I keep saying it, but build relationships. So figure out some folks that you can talk to who are working in public health and just pick their brains, ask them all the questions. But I would also say so you're talking about someone who's already maybe gotten their health degree and they're trying to find the next step. Definitely talk to people. And then, the breadth of public health, there's so many different things, and there's different things that might not be direct public health, but they have a public health component. Like, honestly, some parts of transportation and urban planning. And so maybe broaden your scope a little bit to think about how you can bring your public health perspective and some of your skills to some other industries that you might not think of.
Love it. Number two, if you're talking to someone wanting to get into your position as a business owner, what advice would you give them?
I feel like I'm saying the same thing every time, but relationships. I mean, I would say go for it. I mean, if you're thinking about it, go for it. If you're in a place in your life when that makes sense. And then make those connections, build those relationships. Even if you're not someone who really likes going out and talking to people, find someone who does, and then maybe you partner together and you do the administrative stuff or the thing that you're really good at, and then that person goes out and talks to people. But I think there's a lot of work out there in the consulting space, and I think that was surprising to me when I jumped in, and I was able to meet with a couple folks who just kind of didn't have this. They were really anti-scarcity mentality, it was this idea of like, there's actually a lot out there, and you just don't know it's there because you haven't jumped in. So I would encourage people to do it.
Love that. And I think that needs to be emphasized a lot more in this public health work, that it's not a zero-sum game, that there are so many infinite resources and opportunities out there. So I appreciate you highlighting and lifting that up. Number three, what's something you're working on improving in your life right now?
Well, I'm training to run my very first marathon. So I am trying to improve my running distance. I've done several half marathons and I've loved to run, but it feels really daunting. And so I've never done it. But so it's improving my running and improving my time management so I can run before I'm like too tired at the end of the day. So that's something. And I'm hoping to run a marathon at the beginning of June. So we'll see what happens.
Awesome. We look forward to seeing the picture of you crossing the finish line. You're welcome. Good luck with training. I know how that could be.
Thank you.
And number four, professionally, do you recommend anything?
Yeah, let me look at my podcast list. So there's a couple podcasts that I really like. Harvard Business Review has one called Women at Work. And it's not consulting focused, but it's really addresses a lot of maybe issues that women or people who identify as women might find in the workplace and kind of how to overcome them. And then there's another one called the Solopreneur Hustle. And I think her name's Nia Lewis, but she's got some great tips on just business building. And she has one called Take the Hustle Out of Marketing that I really liked. I have it starred here because marketing, I think, sounds terrifying to a lot of people, but it's like figuring out ways to do it that feels authentic. And then there's another one I like called The Deliberate Freelancer. And she's actually a writer for public health publications, but she has a lot of good tips on kind of business building and setting boundaries and choosing clients and things like that. And then a lot of her people that she interviews on her podcast also run businesses, so then I can go follow their podcast. So it kind of ends up being a nice connection. I think those are three that I like. Yeah, to start with. There's a book called Company of One. And it's the premise that you don't have to grow a big company to be successful or to make an impact. And so that's a good one too.
Love it. And I'll be sure to link those in the description for anyone that's interested in checking them out. And number 5, last and not least, where can people connect with you, Heidi?
You can find me on LinkedIn. That's where I am the most, I would say. And then you can find me on my website, which is it's just my first initial H Berthoud Consulting, because it was going to be way too long of a URL.com. And you can connect with me there. Those are the two places. LinkedIn's really the only social I do. Because I think it's very focused. So I actually do have people reach out to me there, which is great. So those are the best ways.
Awesome. I'll be sure to link that as well. But thank you so much for joining and sharing your story, your insights, and your journey with us. I definitely know that it's going to help someone out there.
Thank you. This has been so great. And I'm so glad you do this podcast. I think it's a great resource. So thank you.
Yeah, my pleasure. Glad to have awesome people like yourself on the show. So housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not subscribed as yet. Leave a 5-star review and share this with a friend. Really helps the show get out to more people. And I appreciate you all. Peace.